I'm John Strum, and this is Real Talk MS. It's July 7th, and we have a lot to talk about. In most every episode of Real Talk MS, we talk about some sort of advancement in developing better treatments or searching for cures for MS. And those conversations are often prompted by newly published results of a research study or clinical trial. Clinical trials really represent the gateway to new treatments for any illness, including multiple sclerosis. Regulatory agencies like the U.S. Food and Drug Administration and the European Medicines Agency base their approval of new medications on the successful outcomes of clinical trials. But clinical trials take years to complete and are incredibly expensive, with costs measured in billions of dollars. The mission of the International Progressive MS Alliance is to accelerate the development of effective disease-modifying and symptom management therapies for people with progressive MS. Now, the way to accelerate the development of new treatments is to find ways to shorten clinical trials. And the way to shorten progressive MS clinical trials is to identify a biomarker that can predict MS progression. This week, instead of focusing on the results of a research study or clinical trial, we're going to get a rare view of how important new research initiatives are started. The International Progressive MS Alliance is about to publish a paper that will recommend advancing research on a specific biomarker for MS progression. As scientists answer the remaining questions about this biomarker and regulatory agencies acknowledge its usefulness in predicting disease progression, scientists can accelerate proof-of-concept clinical trials of new progressive MS therapies, which will encourage drug development and stimulate further investment in progressive MS research. So this becomes a real game changer. Now, today's episode is going to go a little long because we're going to do our best to break down some complicated science. And joining me in that effort are my guests, Dr. Robert Fox and Caroline Sincock. Dr. Fox is a neurologist and vice chair for research at the Cleveland Clinic Neurological Institute, and Caroline Sincock lives with progressive MS. Both Dr. Fox and Caroline are members of the International Progressive MS Alliance Scientific Steering Committee and are among the authors of the new paper that we're getting a pre-publication preview of. But before we get to my conversation with Dr. Fox and Caroline Sincock, there are a few other things that you should know about. Every year since Real Talk MS began, we've put out bonus episodes from ECTRIMS, the largest MS research conference in the world. ECTRIMS is an acronym that stands for the European Committee for Treatment and Research in Multiple Sclerosis. And this year, the ECTRIMS conference was going to be held jointly in Washington, D.C., along with the Americas Committee for Treatment and Research in Multiple Sclerosis. Well, last week, acknowledging the current circumstances dictated by the COVID-19 pandemic, it was announced that the ECTRIMS 2020 conference would be a virtual conference. Now, this doesn't mean we won't have bonus episodes of Real Talk MS featuring the research announcements and presentations that will be made during the conference. It only means that I won't be getting on a plane in order to bring you those episodes. So beginning September 11th, I hope you'll join me for bonus coverage of the virtual 2020 joint ECTRIMS conference. Let's begin this next bit of news with a quick review. MS is caused by the destruction of myelin, the fatty substance that wraps around and insulates nerve cell fibers in our central nervous system. These nerve cell fibers are called axons, and axons conduct the electrical impulses that allow cells to communicate. The breakdown in this communication system is what leads to disability in MS. And these axons are powered by mitochondria. And you can think of mitochondria as a cell's power plant. They produce the energy that a cell uses to do its job. But in MS patients, the mitochondria don't always work the way they should, which impairs the energy production in these cells as demyelination takes place. So an international research team funded by the National MS Society, the MS Society of the United Kingdom, the National Institutes of Health, and a Challenge Award from the International Progressive MS Alliance found that in MS patients, when myelin is damaged, the ability of the axons to produce energy is decreased. The mitochondria try to compensate for this decrease in energy, but aren't successful in offsetting the effects of the myelin damage. Now, the team found that when they administered a treatment designed to increase mitochondrial growth, axonal structure and function was protected. So this increase in energy protected the nerve cells in progressive MS. If further research shows us a way to combine this neuroprotection with treatments that stop the immune attack and restore lost function, the combined therapy could put an end to the damage to the central nervous system that MS creates. And if you'd like to review the details of this study, I'll include a link in today's show notes. A couple of weeks ago, the United Kingdom's National Institute for Health and Care Excellence, known as NICE, did something that, well, many people think wasn't very nice. They decided against recommending siponimod, marketed as Mayzent, as a treatment for active secondary progressive MS. The reason given was that the cost effectiveness of Mayzent couldn't be adequately quantified or qualified. NICE pointed out that the Mayzent clinical trial did not include a comparison with interferon beta 1b, sold in Europe as betaferon and Extavia. And in the UK, interferon beta 1b is the only approved treatment for secondary progressive MS. Now, the NICE report did mention that most people with active secondary progressive MS don't take interferon beta 1b because of its side effects. But without the head-to-head comparison of Mayzent and interferon beta 1b, NICE was unable to recommend Mayzent as a cost-effective therapy to be used by the National Health Service, the public health system for England and Wales. Novartis, the manufacturer of Mayzent, responded to the National Institute for Health and Care Excellence last week, indicating their disappointment at the initial decision that was handed down, saying, and I'll quote now, "If the initial decision from NICE remains unchanged, patients will be denied access to the first licensed oral therapy for secondary progressive MS with active disease, leaving them without an effective, convenient treatment to manage their condition and help them maintain independence for longer. We are committed to work closely with NICE to address outstanding questions and data requirements in order to secure access as quickly as possible to siponimod for those patients in England and Wales that could benefit." And that's the end of the quote. It's worth noting that Mayzent was approved by the European Commission in January to treat active secondary progressive MS, and it was approved by the U.S. Food and Drug Administration to treat active secondary progressive MS in March of 2019. And I should point out that the National Institute for Health and Care Excellence estimates that there are 9,000 people living in England with secondary progressive MS. The Novartis Innovation Prize for Assistive Tech for Multiple Sclerosis was awarded to Access Now, a Canadian company that provides information through its mobile app and web platform that helps people with limited mobility learn and share information about the accessibility of public places like restaurants, hotels, stores, and bars. Access Now received a prize of $250,000 that will hopefully encourage them to increase and extend their efforts at opening up the world to people with MS and other mobility-limiting disabilities. This was the first year that Novartis awarded the Innovation Prize, and I'm hoping that it's the first of what will be an annual award. If you'd like to check out Access Now, I'll include a link in today's show notes. research team examined the association between plasma neurofilament light chain levels and the risk of developing sustained disability worsening in patients with MS. And the recently published results of their study indicate that elevated levels of neurofilament light chain in the early stages of MS have a positive association with the risk of reaching sustained disability worsening or progressive MS. The study notes that neurofilament levels may serve as a predictive tool in assessing the future risk of a patient developing permanent disability. Now, if you'd like to check out this research, you'll find a link in today's show notes. And it's exactly these sorts of observations that the International Progressive MS Alliance Scientific Steering Committee's expert working group took into consideration in developing a paper recommending next steps in advancing research on a specific biomarker that can predict MS progression. The paper will be published shortly, but in a moment, my guests Dr. Robert Fox and Caroline Sincock are going to give us an exclusive preview of what the Alliance is recommending and why it's a potential game changer for progressive MS research. My guests today are Dr. Robert Fox and Caroline Sincock. Dr. Fox is a neurologist at the Cleveland Clinic, where he also serves as vice chair for research in the Neurological Institute. And Caroline Sincock lives with progressive MS. Both Dr. Fox and Caroline are members of the International Progressive MS Alliance Scientific Steering Committee. And specifically, they're both members of an expert working group within the Scientific Steering Committee. And this group was tasked with considering new fluid biomarkers in progressive MS to determine whether there might be a fluid biomarker that could potentially accelerate clinical trials, which would stimulate new research initiatives, enabling faster regulatory approval, and ultimately make new life-changing treatments for progressive MS available more quickly. This working group is about to have their recommendations published, and we're going to be among the first to hear about those findings. Dr. Fox, Caroline, welcome to the podcast.
It's great to be here.
Dr. Fox, I'm hoping that you can start us off by explaining what a biomarker is, what a fluid biomarker is, and then we can get into what the Alliance's working group has concluded and is in fact recommending.
Sure. So first, great question. What is a biomarker? A biomarker is a shortened word or portmanteau. Just like podcast is a portmanteau, biomarker is a shortened word for a biological marker, which means a measurable thing or measurable entity whose presence indicates something such as normal biological process or measure of pathology, measure of what's going wrong in the body. So, for example, one can look at the blood count and know how healthy one's bone marrow is. You can look at the oxygen level in your blood and know how well your heart and your lungs are getting oxygen into the body. Those are biomarkers of different biologic processes. So treatment markers or therapeutic biomarkers are a specific type of biomarker. And it's a type of biomarker that indicates a response to a therapeutic intervention or to a treatment. In relapsing remitting MS, new lesions and MRI are widely utilized as a biomarker of response to treatments for relapsing MS, to the anti-inflammatory therapies. So if one has a reduction in new lesions on MRI, then that's an improvement. If new lesions continue to develop, then that's not as good of a response. And indeed, MRI treatment response in relapsing MS has a very tight association with a clinical treatment response. For example, reduction in relapse rate. So we have a very effective biomarker for relapsing MS. And it raises the question, well, what about progressive MS? And that's where the challenge has been. We do not yet have a sensitive and specific biomarker for use in progressive MS.
So tell me a little bit about what your working group that you and Caroline were both a part of, what it was all about and what it was that you were specifically investigating.
Yeah, so in the body, we think that there are measures, there are things in the blood or in the spinal fluid that will reflect the ongoing damage that is occurring in multiple sclerosis, and more specifically, progressive multiple sclerosis. Now, the Progressive MS Alliance is a group of researchers and advocates and nonprofit groups from around the world that have joined together to try to help advance our understanding of progressive MS and treatments to slow the progression of progressive MS. And a working group was established to look further into fluid biomarkers, biomarkers that are in the blood and the spinal fluid that might indicate, one, the degree of ongoing injury, and hopefully then response to therapies in progressive MS. Now, in scouring through the literature to try to find different biomarkers, one emerged as looking quite attractive, and that is called neurofilaments. So neurofilaments are a family of proteins. So they're cytoskeleton. So they are like bones in the body. So they are the bones within cells that help to keep the structure of the cells. Neurofilaments are only found in the central and the peripheral nervous system. And they help, they're in a sense the girders that, the steel girders of a building. Neurofilaments are to neurons and axons. And they are what gives the structure and the stiffness and get the axons and the neurons doing what they need to do. Now, when a neuron is injured, these neurofilaments are released. They're released first into the spinal fluid, that is the fluid that bathes the brain and the spinal cord, and then eventually they move out of the spinal fluid into the blood. Now, these neurofilaments are released regardless of the cause of injury. Neurofilaments are released, and so it could be traumatic brain injury or a stroke or a brain tumor or multiple sclerosis. Any injury to the brain or the spinal cord can cause release of those neurofilaments that can then go into the spinal fluid and eventually into the blood. One nice thing about neurofilaments is that they're rather sturdy proteins. As you might imagine, since they're the steel girders of axons, it's a protein that doesn't break down very easily. And that's ideal for a marker because you want the marker to stick around a little while so you have a chance to measure it in either the spinal fluid or the blood. Unfortunately, neurofilaments do stick around and they pass quite easily into the blood. And that's particularly helpful because patients don't want to have to keep getting spinal taps to measure how well their MS is doing or how they're responding to an MS therapy. So neurofilaments can be measured in the blood to reflect how much injury is going on within the brain and the spinal cord.
Well, you mentioned how neurofilaments are released when any number of different events might occur in the brain, from stroke to brain injury to multiple sclerosis. Is there a way to tell the difference so that someone like yourself would know that looking at or measuring neurofilament light chain in a blood serum sample might in fact point to multiple sclerosis as opposed to something else?
Right now, no, we don't. And that is one of the drawbacks of neurofilaments, is that although it is sensitive to the injury of multiple sclerosis, it is definitely not specific for it, meaning other injuries to the brain and the spinal cord can also release neurofilaments. So neurofilaments can't differentiate between a stroke or a brain tumor or other diseases that affect the brain and the spinal cord. So unfortunately, no, it is, although sensitive to MS, it's not specific. Other diseases can cause release of that. And it gets even more complicated because as people get older, the background levels of neurofilament, just the normal amount of neurofilament that is released from the brain into the spinal fluid and eventually into the blood gradually increases. So this is just part of normal aging. So there isn't just a standard amount of neurofilament, which is the background neurofilament in the spinal fluid and the blood, but it depends upon age.
So it sounds like there's work yet to be done in really better understanding or defining the role of neurofilament in terms of MS. What is the conclusion or the recommendation that your working group on behalf of the International Progressive MS Alliance is making?
Yeah, so when this group reviewed all the data, with the limitations that I just mentioned, it's not specific for MS, so it needs to be recognized to have some limitations. There were two main ways of using neurofilament that this group recommended to be considered and to get more research around how to do it. So one is that neurofilament in the blood appears to be a prognostic biomarker, meaning it appears to predict future problems with MS, particularly future disease progression. So patients with a higher amount of neurofilament at any point in their disease seem to have a worse long-term course. And so that identifies patients we need to be more worried about and perhaps take more aggressive management in trying to get their MS under better control. The other recommendation that the group made is to further explore serum neurofilament or neurofilament in the blood as a treatment response biomarker to be used as an endpoint or an outcome to monitor clinical trials in progressive MS. So, and whether this can be useful or not remains unclear, but the group recommends that we look further into this biomarker, looking at the biobanks that have been created in the previous progressive MS trials to understand how serum neurofilament or neurofilament in the blood can be used as a treatment response biomarker to show a positive response versus a less than positive non-response to a treatment in progressive MS.
Well, thank you, Dr. Fox. I'm going to circle back with you in just a moment. Caroline, I want to bring you into our conversation. And first, I have to say it's a treat for me to talk to you about this. You know, many of my listeners have heard me talk about my experiences as a member of the Alliance Scientific Steering Committee. And I always remind them that I'm one of 3 people affected by progressive MS who are members of the committee. Along with our third MS Katir, I'll give a shout out to Alexis Donnelly. The 3 of us all work to ensure that the perspective and the priorities of people affected by progressive MS are represented in all the work undertaken by the Alliance. And your participation in this fluid biomarker working group is a perfect example of how that fundamental aspect of the Alliance actually works. So, as someone who's living with progressive MS, I want to get your thoughts about how people with progressive MS will benefit if we can adopt neurofilament as a biomarker for disease progression. And then I'd like to get into your actual experience in this working group.
That's great, John. I'd be happy to talk about both of those things. But I think, firstly, both your introduction, John, and also how Bob has just described neurofilaments and particularly about fluid biomarkers is vital for setting the scene here, particularly because it explains how complicated this is and how little is really known so far, and how for relapsing MS there is something which we can use as a biomarker very effectively, but how we just haven't got that yet for progressive MS, whether we're using it in a diagnostic, prognostic, or indeed as a treatment response biomarker. And the important thing which came out to me from working in this group is, which I must admit, I knew that biomarkers are important. I didn't realize until joining this group just quite how critical, how vital they are to all of the clinical trials and all the work that goes on elsewhere, whether these drugs or other interventions. And these are almost like the building blocks of the trials. If we don't have these, the trials themselves can be considered inadequate and certainly take a hell of a lot longer. So I think one of the biggest benefits to people affected by MS by working on biomarkers, irrespective of their fluid or otherwise, is because they're going to help us move those trials forward more quickly, more effectively, and therefore, as a consequence, they're more likely to prove positive outcomes quickly for those of us affected by MS. And I think if they are cheaper, the other thing we've got to bear in mind is that companies are more likely to actually go ahead with that research and go ahead with those clinical trials, such the results are more likely to come out, and therefore therapies and treatments for those of us with progressive MS are more likely to happen. I think Bob has also highlighted what the benefits are of fluid biomarkers, in particular one that's accessible from blood. And I think that we need biomarkers which obviously identify things, I've said already, quickly, but easily, reliably, and I would say in some ways as painlessly as possible. And I think, again, if we can get these biomarkers from fluid, and particularly from blood, then we've got a means to be able to extract it, which is going to be considerably more beneficial to those of us who are the patients who are participating, or indeed those for which this is going to be used as a prognostic marker. So there are lots of reasons why we need biomarkers. And very, very important reasons, because they, particularly for therapeutic trials, they are absolutely critical. Fluid biomarker has got a whole lot of benefits attached to it. Having a biomarker which actually is a consequence of being in blood is even better because of its simplicity of extraction, the painlessness of extraction, the cheapness of extraction, and therefore its use. I had no idea until joining this group quite how complicated just identifying a plausible candidate is going to be. I certainly had no idea of all the means that was going to have to go through to all the ways in which those various candidates were going to be assessed. And that's basically what this expert group did. They assessed all these various candidates and came up with what was the best fit, as well as identifying two potential uses which they were looking to take further in each instance. But what I also think is important about this group is that it highlighted that this is the first one. It's like paving the way. So if we get one through, whether it's through the regulatory approval, or it's just through the whole individual process of the selection here that we're talking about, that paves the way for others that follow afterwards. It makes, and we have it's like a standard operating procedure almost to go through to try and help us evaluate these and validate these biomarkers. And that's important. So even if this one doesn't quite meet the mark or doesn't do it to quite the extent we want it to, this work has still been extremely valuable. I think my role in this was, well, one, it took me a while to understand the science, as you can perhaps, well, I don't fully understand the science, but I understand enough of the science to go along with this. And I have to thank Bob and others who are on that expert group. We're making sure along the way I understood what was going on, such that I could truly contribute. And I think that's very much a hallmark of the Alliance. They have done in every instance that you and John, you and Alexis and I have been involved in this. They've always helped us make sure we can participate fully, and I felt this group did that very, very much. I think our role in the Alliance is manifold, but I think being able to set the priorities of the Alliance, like you've said, and being able to, as members of the Scientific Steering Committee, we have a responsibility to set those priorities and indeed scientific direction, and indeed to be involved in some of the more key decision-making areas, such as the Network Awards, which again I'm sure, John, you've talked to your listeners about. But I think this particular group was something which also showed that there was a real benefit in having the person affected by MS in the room, because not only do I think I was able to ensure, although I'm sure the group may have done so anyway, ensure that it kept on track to say this has got to be meaningful outcomes for people affected by MS, but I also think I was able to ask the daft wee laddie question, which sometimes not the question was particularly illuminating, but the answer could be quite illuminating. I also think I was there partly to motivate and encourage people to keep on track, because I was aware that in the room were a number of particularly industry experts who worked in labs who actually didn't encounter people with MS, progressive or otherwise, and therefore to be able to realise the benefits of the work they were doing, I think was motivational. And to keep it real, therefore, for people, I think was very important to encourage that expert group in its enthusiasm and putting its resources to come to the conclusions it's come to. So I was delighted and honoured to be involved, John. As you know, for the rest of the Alliance work, we are humbled by the intellect and energy and dedication of other people in those scientific steering committee groups.
You're touching on something that I was hoping we'd get into a little bit. And so maybe we can step back from the specifics of a neurofilament biomarker and talk about this broader issue for a moment. You know, when you look at MS research today, there's a serious conversation taking place about not only thinking of people living with MS as potential sources of data in a research initiative, but more fully engaging them, giving them a voice in all of the decision-making aspects of a research project or even organization. I think you and I are both examples of that kind of thinking. For the past 5 years, we've occupied that role of being fully engaged participants, as you just said, in every aspect of the work that the Progressive MS Alliance undertakes. It's easy to forget that this is still a very new concept for so many people. So I'm hoping you can share a bit more of your thoughts about that aspect of your experience.
Well, you're right, John. I think we have been fully engaged and throughout the whole of our time with the Alliance. And I feel very honoured to have been allowed to have that position to represent so many other people with progressive MS. I've only had positive experiences in my engagement as a person affected by MS, both here and indeed in other environments. So I've been very lucky, but I think you're right to say that it's actually a very new concept in many ways. The Alliance, I think, has done it extremely well, bringing us on board from the very beginning, giving us a degree of introduction and induction, as well as making sure we knew everybody in the room. So we were free to talk, ask questions, and learn ourselves about what was the reasons we were there. I think we have made a difference, or I hope we've made a difference, not just in actually determining the scientific direction and the research priorities, but actually in some more fundamental and really obvious ways. And I think the one I'd probably pick out is with the Network Awards, which are serious sums of money that have been given to 3 consortia. Those decisions were made very much with us on that judging panel. And we were not only bringing to bear our views on whether or not this was important and relevant to people with progressive MS, but also we were looking at other issues. For example, was the patient burden going to be something which was going to perhaps deter engagement? And as a consequence, was this going to be something which meant the study itself was going to be less robust, statistically, if nothing else? We were also looking at things like how that work was going to be disseminated to the lay community in general, but particularly people affected by progressive MS. We were looking at issues such as how they were involving, in a sort of scientific and steering committee type way, people with the condition. So we were evaluating those awards on quite different criteria to perhaps the scientific criteria, which others were reviewing them on, but just as valuable and just as important. And I think our voices on those issues were very much heard and indeed incorporated in decision making. I think we have a number of other roles, as you well know, John, not least is communication. One from, say, this expert group that I'm talking about here with the fluid biomarkers back to other members of the Alliance, but also out the way, such as we're doing now, to emphasize the importance of this piece of work, which I think I've said already, I think others cannot see immediately how important it is, and we need to get that across. This is critical work. And so our role as members of the Alliance is not just inward in the discussions there, it's outward to do that communication. I also have mentioned before that I think it's important that we are keeping it real for the researchers, indeed thanking them for the work they're doing, and the other members of the Alliance here, to remind them of why they're there, to motivate them and enthuse them. And I think that perhaps that communication role to others also includes to funders as well, where I think it's important that we're able to put across that the Alliance is doing it well and is hearing the voices of those who are being affected by this condition and are incorporating and engaging them from the very beginning. So I have been humbled, honoured, and also delighted by the way in which we've been involved in this, and I know that you have as well. It's a difficult job, though, John, as you well know. I mean, we're bringing our own lived experience to the table, but MS and progressive MS in particular, I think is such a variable condition. I think I heard somebody calling it a snowflake condition. Every person's disease path, as well as every person's actual presentation, is unique. And we're trying to make sure, the three of us, and indeed others that perhaps joining us along the line here, that we can represent not only our own lived experience and bring that to the table, but use the knowledge we have of other people that we know with MS, with progressive MS, and bring their experiences as well, and make this therefore meaningful to a much broader group. And I hope that's what we manage and are able to do.
Well, I share that hope, and very well said. Dr. Fox, with the pending publication of this paper concluding that neurofilaments may, in fact, be a plausible biomarker for progressive MS, what's next?
Well, there are a couple steps that need to be done, and there were three specific steps that were outlined in our paper. One is that sample collection and assay methods. So assay is the way a machine measures how much neurofilament is in the serum or the spinal fluid. The sample collection and the assay methods need to be standardized. And they need to be standardized so that we can align the results across previous studies as well as future studies. We're hoping that many manufacturers of lab measurement tools will produce ways of measuring neurofilament, and we need to be able to compare those results from one platform or one machine to another machine. And therefore, we need to be able to compare the results across the world. What we also need is a normative database, meaning a database of normal values in non-disease, meaning otherwise healthy volunteers. So this database needs to account for the effects of age and other conditions, what we call comorbidities, meaning other conditions that may affect neurofilament levels, like diabetes and hypertension. Other brain injuries like stroke, we need to know how much that can affect it and for how long. So it's pretty easy if we're measuring someone's physical disability that when they break a leg and they're on crutches, we shouldn't pay attention to their measure because their broken leg is impacting our measurement of disability. In a similar way, when patients have something else going on in their brain that's going to affect neurofilaments, we don't want to be misled by an inappropriate measurement. But for how long do we ignore the measures before we say, okay, now this is representative of the MS? So we need to understand comorbidities or other conditions so that we can learn how to implement it not only in clinical trials, but also in routine clinical practice. And then finally, we need to go back to all these existing databases. There are a lot of databases, both clinical trials and long-term cohorts. So groups of patients that are being followed by researchers over time, and pull those samples out of the freezer and analyze them so we can understand how the measurements of neurofilaments reflect what's going on with their underlying progression. We also need to understand better how to differentiate the active inflammation, meaning new lesions that we see more commonly in relapsing MS, from the gradual little by little decline that we see in progressive MS. And recognizing that both processes, both the active inflammation of relapsing MS and that other process, that relentless little by little decline of progressive MS, both of them are associated with the release of neurofilaments. And how do we understand what is coming from which aspect of MS? That we need to understand better.
Well, I think the steps and recommendations that you just cited serve as an ideal example of how the Alliance can impact and influence the global MS research agenda. Caroline, any final thoughts on your experience as part of this working group?
Well, I think the work on this fluid biomarkers expert group emphasised to me what I thought was a lot of the strengths and the values of the Alliance. And in particular, I want to highlight the collaborative working. Around that table, we had together clinicians, researchers, industry representatives, donors in one instance, and indeed, obviously, people affected by MS. And all of them were working for the common good. And it was quite remarkable, that collegiate feel in the room that has, I think, enabled this work to happen and to happen so quickly. And I'd like to highlight here, there was a number of different industry experts. And particularly, these are representative companies that normally are in, I would think, competition. The fact that we're all working together for the common good, I think, was remarkable. It's very unusual to have that group of organisations, the representatives of those organisations, round one table, working together and quite so openly. And I think that's as a result of the auspices, the culture, if you like, of the Alliance, helping that and making that happen. I think, again, the other thing that that particular expert group has highlighted is that the Alliance has proved that we have to look at some of these difficult questions. I mean, hearing Bob speak, you can hear and understand about all the various complicated issues that have to be looked at to try and find a biomarker, a fluid biomarker in particular, for progressive MS. Now, the Alliance has meant people have the confidence not to shy away from these difficult questions. I think has helped set the agenda for these difficult questions, meaning that people are prepared to add energy and expertise, perhaps being less afeard of failure as a consequence, and knowing that it's going to be still important even if there are challenges along the way. So I think this group emphasised to me some huge values of the Alliance. Obviously, the other Alliance value which was represented there is the integration, engagement of people affected by MS all the way through the process. And indeed, our voices were listened to, as well as meaning that the meaningful outcomes are for people with progressive MS, not for the researchers or for the companies necessarily. So I'd like to highlight that this was illuminating and very refreshing engagement as far as I was concerned, emphasizing to me the reasons why I became involved in the Alliance in the first instance.
Dr. Robert Fox and Caroline Sincock, thank you for helping us gain an understanding of some of the work that the International Progressive MS Alliance is doing to accelerate the development of new treatments for progressive MS and to improve the quality of life for people affected by progressive MS. And thanks for talking with me today.
Thank you, John. It was a pleasure to be with you.
Yes, John, thanks for having us on to share a little bit about neurofilament.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/149. You'll find that link in today's show notes so you can easily copy and paste it right into an email or text. I don't think that I have to tell anyone listening to this podcast that the COVID-19 pandemic has intensified and in many cases multiplied the challenges of living with MS. From having difficulty affording MS medications, to adjusting to increased isolation, to coping with the added uncertainty of wondering how you or your family might be personally affected by COVID-19. More than ever before, people living with MS need access to reliable information, support, and connection. We're witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. So they've established the National MS Society COVID-19 Response Fund to ensure that the Society can continue meeting the urgent and expanding needs of the MS community during these unprecedented times. During the pandemic, we've seen the MS Society create virtual programming and support groups literally on the fly so that no one has to face MS alone. They've created resources and provided information so that doctors and nurses can deliver the very best care. They've continued to amplify the voices of the MS movement to influence critical public policy decisions, and they've never stopped advancing research to find cures for MS. I know that these are financially tough times for a lot of people, but I'm asking that as you're able, if you're able, please make a donation to support the National MS Society. To donate, you can text the word GIVE to 68686 and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. Or if you prefer, I've created an online shortcut to get you to that same webpage, so you can visit realtalkms.com/COVID-19 Response Fund and make your donation. And you'll find that link in today's show notes. However you choose to contribute, please contribute today. It's never been more important. I'm John Strum. Thanks for listening. Stay safe and make healthy choices.